Custom-tailored treatment to hit the cancer. Call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman. 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and for the callers, best way to find us here on the show is 1-800-321-0710, 1-800-321-0710, and we'll put you on the air. I want to talk about a patient. We just talked about how 1 hour might save or change your life. This is a man, 56 years old, married with 2 children, loving wife, loving daughters. Came to me with this story just this week. He had a particular unusual kind of cancer called small cell cancer of the prostate. He was fine until April this year. He developed pelvic pain. He was found to have a big pelvic mass, and he had a biopsy which showed small cell cancer of the prostate, so it's a rare kind of cancer of the prostate. He went to one of those big cancer hospitals that say they treat more patients in a second than everyone else treats in their lifetime. Well, they gave him chemo. They staged him up. They found he had cancer in the prostate, spread to the lymph nodes. He had chemo. It didn't work. He couldn't urinate. They put a catheter in. He had more chemo. They gave him morphine. And Tuesday he came to see me. He was in so much pain. He was moving and shaking and squatting and standing and twisting and turning, and it was terrible to see how much pain he was in. He had the catheter in, and this big cancer hospital was going to do a colostomy the next day. He was scheduled for colostomy. Everything was set for colostomy. Colostomy is when they operate, they open up your belly, take out your intestines, and instead of going to the bathroom the usual way, you have a bag attached to your abdomen, and the feces goes into the bag. So it's a big change in quality of life. Terrible. This man was in terrible pain. We got staged. The cancer was growing. The chemo wasn't working. It never worked, in fact. He was at the big cancer hospital, which advertises how much experience they have. They left him in pain. They're going to do a colostomy. He came to us on Tuesday, saw him, staged him, adjusted his medicine, started radiosurgery to this big mass, about the size of a watermelon. People say, can you treat big tumors? Can you treat small tumors? Can you treat... Yeah, we've done it before. We've done 20,000 patients. We were the first in America with radiosurgery. We have the experience, even if you've had chemoradiation surgery, even if it doesn't work, even if you're at the most famous place. Yeah, this is the kind of patient that we see. By Friday, instead of having a colostomy, he was cancer controlled. The cancer we treated. The pain was controlled. I called him up, asked him how he's doing. He said he was fine. So by seeing him, adjusting his medicine, he canceled his colostomy, he had radiosurgery, and he's better, much better, tremendously better, and we're going to continue treating him with radiosurgery. Our success rate, even for a big mass like that, it's about the size of a watermelon, it's huge in the pelvis, it's about 90%. So most likely, and 90% is not for 3 weeks or 6 weeks or 12 weeks, no. Our data is for the life of the patient. So I think he understands that the possibility of a fresh second opinion may change, and probably already changed his life. His body is intact today. It wouldn't have been if he didn't come to radiosurgery on Tuesday. He would have had that colostomy on Wednesday at that cancer hospital, and his life would have changed forever. I also want to talk today about a new article of node-positive prostate cancer. So about typical prostate cancer. What happens for people who have surgery who are node-positive? positive. Well, there was an article published in the Journal of Clinical Oncology just now by Abdullah that found that adjuvant, meaning additional radiotherapy, is associated with a survival benefit in people with lymph node positive, intermediate to high-grade prostate cancer. So, of course, we don't advocate, and I don't advocate surgery for prostate cancer, but what happens to the men, like the man who was crying last night, they had all these complications? Well, can radiation help them? Well, the answer is most likely yes. The study involved 1,107 men. It was published in the Journal of Clinical Oncology, which is a very respected journal. These were with node-positive prostate cancer, treated with radical prostatectomy and lymph nodes removed between 2010 and 1988, so over a long period of time. And they received additional hormonal therapy with or without radiation. So 35% of the men had radiation, and there was a significant lower risk of death in the men who got the radiation. So can radiation help you, even if you had surgery for prostate cancer, even if you didn't know about our work before and now you do? Yes, it can. It was in patients with Gleason 7 to 10, prostate cancer, positive margins, positive nodes. Those people had a marked increased statistical improvement in survival, being less likely to die of prostate cancer if you have radiation. So even if you had the surgery, if you've already had it for prostate cancer, you may want to come in and talk about other things you can do to have a better life, longer life, and less likely to die of prostate cancer. The investigators in their article in the Journal of Clinical Oncology concluded the beneficial impact of radiation on survival in patients with node-positive prostate cancer is highly influenced by tumor characteristics. Men with low-volume nodal disease, 2 or more positive lymph nodes in the presence of intermediate to high-grade non-confined prostate cancer, and those with intermediate volume nodal disease, 3 or 4 positive nodes, represent the ideal candidates for radiation after surgery. So it's something to think about, to try to save your life, even if, unfortunately, you chose surgery for the prostate cancer. We're here to provide that information to you because we know with 250,000 men a year in America, there's lots of good stories and there's lots of sad stories, and we're trying to minimize the sad outcomes by salvage or second-line therapy whenever possible. So if you have questions, you can call us on the show, which is 800-321-0710. And for medical questions during the week or after the show, please call us at 212-CHOICES, which is 212-246-4237. We had a Hispanic man, 53 years old. He's a computer engineer. He's from Colombia, South America. He's married with 4 kids. He has adenocarcinoma of the lung, and he has severe pain. The cancer has traveled to the bones. It traveled to the spine. It traveled to the lumbar spine and sacral spine. And we saw this man this week also, and he was in terrible pain. He went to the chiropractor, and he had an MRI. First he went to a hospital, and they thought he had a dissection of his aorta, which is where the main blood vessel breaks up, causing pain. Well, that didn't make very much sense because there's signs of that, and he doesn't have the signs. So he went to a hospital in the Burroughs. He had a chest x-ray, a lung nodule, and found to have metastasis. Then, for some reason, he was just sent out of the hospital without any treatment. He came to us with adenocarcinoma of the lung, had trouble, terrible pain. He used to run 5 miles a day. Now he can barely move. He doesn't have spinal cord compression. Spinal cord compression is where the cancer grabs around the spine and cuts off the spine and stops the spine and the nerves from working. He didn't have that, but we had cancer in the bone of the spine. We saw him this week. He was in terrible pain, trouble walking because of this pain. We started treatment. He's already had 2 treatments, and he's already better, which is what we want. We want people to have quick quick relief. By the way, with our focused beam radiation, we usually just give a few treatments. So unlike places that give 10 treatments or 20 treatments or 30 treatments, and you probably know about those places, actually there's radiobiology studies which show if you give a few treatments that are more intensive, more direct, and we've done a lot of the work here at Radiosurgery New York, you have a higher control rate, it's more durable, and faster relief of pain and suffering. So for cancer patients who have pain and suffering, it's another reason to come. So some people come to save their life. Some people come to get the cancer in remission. Some people come to save the breast. Some people come to avoid prostate surgery. They want to keep their sex life, their urinary life, and their life to be cancer-free. Some people come to get out of terrible pain. And this man, in 2 treatments, got rid of the terrible pain. So he's walking better. His pain is pretty much gone. He's happy. We're happy for him. And another good news department, we had a man with prostate cancer, Gleason 7, PSA 7, just treated this year. Came back with a follow-up. His PSA is already down to 1.1. It's down by 85%. He's in remission, doing well, fully functional. That's where we want him to be, and most likely that's where he's going to stay. Excuse me. Another man who came in with leukemia. He had a leukemia. Some people with leukemia have a lymphoma phase where the white blood cells are so vast they lodge in the lymph nodes. He had 2 masses, one in the right neck, one in the left neck. It's called a lymphoma phase of leukemia. It was unsightly. It was uncomfortable. His blood count was 70,000 white blood count. He came to us, got a few treatments on the left. This big mass, which was like the size of a very large man's fist, went completely away in just a couple treatments. He had never seen this or thought it possible. He was so pleased, and he wanted us to treat the mass on the right side of his neck, which was also massive. We treated both masses. Now they're gone. His blood count went from 70,000 white blood count down to almost normal. So he got rid of his white blood count elevation. He got rid of this painful, uncomfortable, unsightly, massive lymph node, what's called adenopathy. He is happy. We're happy. He thinks it's a miracle, but this is the kind of work that we do every day. My name is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center. We're a private cancer treatment center, which means we work for you, the patient, not for the insurance company, not for the drug company, not for the surgeons. It's a private company. We take your insurance, Medicare, Medicaid. Our work is for you. You have our phone number. You can call day or night if you have a medical problem. We're here for you. We don't have machines answering. We have human beings answering. You know who we are. We know who you are. The costs are less. I think the response is better. It's a personal relationship. We have linear accelerators. We have CAT scans. We have operating room. We have hyperthermia. We're one of the few cancer treatment facilities with hyperthermia and a complete physics staff to do all of the work, and we're centrally located in the heart of Manhattan at 38th and Broadway, which means it's easy to get to us. We're close to the subways, the trains, the buses, Penn Station, Grand Central, Port Authority, PATH trains. Yeah, you can drive if you want, but it's easy to get to us the other ways. And we take your calls when you have a question. You can talk to the doctor, not the students, not the residents, not the machines. So we're a little different, I think a lot different than most every other place. Again, this is Dr. Lederman. We're going to stop for just a moment to hear from some new voices about our work, and then we'll be right back to take your questions, take your calls, and provide more information. Here we go.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, First for you with Body Radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers